Hello and welcome to the final module of the program ARSH4U. In this module, we covered some essential topics on conception, contraception, reproductive tract infections and sexually transmitted infections including HIV. It is important for adolescents to have this information so that they can take informed decisions on their sexual lives and practice safer sex and avoid unintended pregnancies and sexually transmitted infections. In this video, let us revisit the topics of contraception and abortion. Contraception. Contraception is any method used to prevent pregnancy. Aside from preventing unintended pregnancies, contraceptives like condoms also protect from sexually transmitted infections that are STIs. There are many contraceptive methods available for males and females. And to be able to decide which one is most appropriate for one's personal needs, it is essential to have correct and complete information about different contraceptive methods. To tell us more about the various methods of contraception, we have with us Dr. Joshi who's a gynecologist. Ma'am, welcome to the show. We are so pleased to have you with us and it will be of immense use to our learners.
Hello Vasundhara, thank you for having me here.
Doctor, today we are discussing contraceptives.
Yes, using contraception is a very important decision that one takes if they wish to be sexually active but do not get pregnant.
And there are many types of contraceptives available and each one of it has its own pros and cons.
Absolutely. Let's start with condoms.
These are available off the shelf at most medical stores.
Yes, male condoms are very readily available in medical stores and also available free of cost in the public health system. Male condoms are made from latex. Nowadays, there are also some plastic ones, generally used by those who are allergic to latex. Condom is usually worn over the penis during sex. It acts as a barrier that will collect the semen and prevent it from reaching the vagina. Using a condom will protect both the partners from sexually transmitted infections.
Doctor, I've heard that there are condoms for females also.
Yes, there are condoms for both males and females, but they are not as freely available or as convenient or as economical as the male condoms. So let us talk about the male condoms here, as they are more readily available and also more prevalent. One important thing to remember about condoms is that they are meant for a single use only. That is, a new and an unused condom must be worn before every act of sexual intercourse. These are very effective and safe, but only if used correctly and consistently. Detailed instructions on how to use a condom are given on the packet, and it is very important to read and understand them to use a condom correctly.
What are some other types of contraceptives, doctor?
There are also oral contraceptive pills which are available for women.
And I've heard that these two are of different types.
Yes, let's understand them one by one. First, there are hormonal oral contraceptive pills. As the name suggests, the hormonal pills contain the hormones estrogen and progesterone. These hormones prevent the release of the egg from the ovaries to prevent fertilization or pregnancy. These pills must be taken regularly every day for the period during which one wants to avoid pregnancy. Fertility returns instantly when one stops taking the pill.
Dr. Joshi, are there any side effects of these?
Although the pills are very safe and medically tested methods of contraception, some women may experience irregular bleeding. Sometimes menstruation may reduce or stop completely also with these pills.
And where can we get these pills from?
Like the condoms, these pills are also widely available with the chemists and available free of cost in the public healthcare system. However, one should always consult a doctor before starting their use. And another important thing, unlike condoms, hormonal contraceptive pills do not protect you from sexually transmitted infections.
And what are the other types of contraceptive pills?
The other type of contraceptive pills which are available are the non-hormonal contraceptive pills. These contraceptive pills do not contain any hormones. They have to be taken twice a week for the first 12 weeks and then following that once every week.
So twice a week for the first 12 weeks and then once every week, am I right?
That's right. And before one starts taking them, they must ensure that they are not pregnant. That is why people are advised to consult a doctor before using them. These contraceptive pills are also safe and medically tested, but they may result in instances of irregular bleeding in some women.
Are there other types of contraceptives available too, doctor?
Yes, there are also injectables, there are the IUCDs, and there's also sterilization. Let's talk about all of them one by one. First, the injectables. These injections contain the hormone progesterone. They have to be administered to the women by a doctor or a nurse once every 3 months. These injections must be given during the first 5 days of the period.
Are there any side effects of these too?
Yes. While using these injections, some women may experience reduced menstrual flow or their periods may stop altogether.
Are these methods of contraception permanent?
No, they are not. Fertility returns after a few months once you discontinue the injections.
Doctor, you also mentioned IUCD.
Yes, women may also use an IUCD. Copper T is a well-known IUCD. This is a small T-shaped device which is inserted inside the uterus, and it comes in 2 variants. One that prevents pregnancies for 5 years and the other one which prevents it for 10 years.
Wow, this seems interesting. Okay, so can this be inserted by the woman herself?
No. Inserting the device in the body is a medical procedure that must be done by a doctor or a nurse only.
I see. So this device stays in the body for years together. And are there any side effects of using it?
A very good question, Vasundhara. Although IUCD is a medically validated contraceptive method and it is widely used across the world, it can lead to heavier menstrual blood flow, and one may also experience enhanced pain or cramps during their periods. Copper T is a long-acting method, preventing pregnancies for up to 5 to 10 years. But it is not a permanent form of contraception. Fertility returns once you remove the device.
Is there a permanent method of contraception for those who do not want to have any more children?
Yes, indeed. There is sterilization.
What is that?
These are simple surgical procedures for those men and women who do not want to have children. The surgical procedure for men is known as vasectomy, and the surgery for women is called a tubectomy.
Vasectomy and a tubectomy. Are these complicated surgeries?
Not at all. These are relatively simple surgeries, and men and women can go back on the same day. In fact, vasectomy is a much simpler procedure and does not need any post-surgical rest and can return to normal work the very next day. Whereas a woman may need a few days to get back to normal course of work, still, very few men actually opt for vasectomy. However, it is important that sterilization procedures are performed by trained doctors in a clinical setting with necessary backup. Antiseptic precautions must be observed while conducting these surgical procedures. Otherwise, there can be serious complications, especially for women, including posing a danger to life. One more thing, in case of men, vasectomy becomes effective only 3 months after the procedure. Till then, if one needs protection, it is best to use some other form of contraception. So, we have covered all the contraceptive methods that are available in India and can help prevent against unintended pregnancies. However, Vasundhara, remember that only male condoms can protect partners from sexually transmitted infections. But accidents happen. Sometimes there may be contraceptive failure, like a condom bursting during intercourse, or people may have had unprotected sex but still want to avoid pregnancies. In such scenarios, they may take an emergency contraceptive pill. Emergency contraceptive pills are also widely available within medical stores. They should be taken within 72 hours of having unprotected sex. The sooner one takes it, the more effective they are. But they do not provide a guarantee of not getting pregnant, nor do they offer any protection for any future unsafe exposure.
Doctor, are there any side effects of these pills?
Yes, although they are medically tested and are generally safe, but taking emergency pills may lead to irregular menstruation, vomiting, headaches, and painful and sensitive breast in some women. And therefore, one must avoid using them in situations other than emergencies. In fact, if taken regularly, they may even become ineffective.
With so many contraceptive methods available, which should one decide is the best for us?
To be able to decide the most appropriate and safe contraceptive methods based on your needs, it is essential to have correct and complete information. It is responsibility of both the partners to keep themselves and each other safe.
Also, if I may add here, to understand what contraceptive is best suited to different scenarios, you must review the activities in the module ABC of Contraceptives and pick the right contraceptive. These present case studies of different scenarios and explain which contraceptives are suited to which situation. Well, thanks Dr. Shuchi. You have told us about these contraceptive methods, and there is no doubt that it is immensely important to have adequate knowledge about the different contraception methods and their pros and cons.
Yes, Vasundhara. But sometimes a number of factors can result in unintended pregnancy. Some such factors may be lack of information on contraceptives, lack of access to contraceptive methods, failure of contraception, rape, or an inability to negotiate contraceptive use with partner. In such cases, one may need to consider having an abortion.
This is important. Can you tell us more about abortion?
Yes, of course. Abortion is the voluntary termination of pregnancy. There are two safe ways to have an abortion: a medical abortion and a surgical abortion. In case of medical abortion, a medicinal course is administered, whereas in a surgical abortion, one undergoes a minor surgical procedure.
How does a person decide how to opt for one?
Medical abortion is usually done if pregnancy is terminated within 9 weeks of conception. If an abortion is required at a later stage of pregnancy, or if there are any other surgical complications, a surgical abortion is performed.
Where can a person go for an abortion?
An abortion should only be performed by a registered medical practitioner. There are many unlicensed abortion clinics, and sometimes people are told that they can self-induce an abortion by inserting an object into the vagina, taking medicines without supervision, or taking some herbal medicines. These methods are not safe, they are not legal, and they are not effective. Sometimes they may even result in temporary or permanent harm to the woman.
But there's so much stigma around abortions that many women are hesitant to approach doctors.
So true. But in India, the Medical Termination of Pregnancy Act, also known as the MTP Act, upholds the right of every woman to access safe and affordable abortion services in any government hospital or approved clinic or any facility up to 20 weeks of pregnancy, provided they meet certain conditions. Like, the pregnancy involves the risk to the woman's life, including physical or mental health. The pregnancy is a result of a rape. The pregnancy is a cause of contraception failure. This is valid for married women only. And the fetus shows signs of possible physical, mental, or other disabilities.
Yes, I have read about the MTP Act before. It states that currently abortion is legal up to 20 weeks of pregnancy. Although after the 12th week, one needs the opinion of 2 registered doctors, except in the case of an emergency. Abortion must only be performed by a registered doctor in a government hospital or any other approved medical facility.
Exactly right, Vasundhara. In January 2020, the Union Cabinet approved an amendment to the MTP Act, which proposed extending the upper limit for abortions to 24 weeks from the current 20 weeks. This is yet to be presented in and approved by the Parliament though.
That is very helpful information, Doctor. Thank you so much for your time.
It was a pleasure to be here. Thank you so much.
We now come to a very interesting debate. Who decides when a woman can have an abortion? As per the MTP Act, if a woman is above 18 years of age, she only needs to give her own consent for abortion. In case she is a minor, that is under 18 years of age, or is unable to give an informed consent due to disabilities, she needs the consent of her parents or guardian for the abortion. However, under the Protection of Children from Sexual Offences Act, that is the POCSO Act, a person who is under 18 years of age can access abortion services without taking any permission from their legal guardian. But the service provider must report this to the concerned authorities. They do not have to file a complaint or a FIR, but must proactively provide information to the authorities about the service provided to a minor. Although, as per law, a woman above 18 years of age does not need another person's consent before getting an abortion. That is, unfortunately, not so in practice. We see many cases where women are denied choice or are not able to make decisions for themselves, such as deciding when to get married or who to marry. Similarly, even with pregnancies and abortions, women are often not given the sole choice to make decisions about their own bodies and health. Therefore, we must all work to uphold a person's right to be able to make informed decisions about their bodies and their reproductive health. While respecting choice, it is equally important that abortions are not used for sex selection. In India, the Preconception and Prenatal Diagnosis Techniques Act, that is the PCP-NDT Act, bans sex determination tests and related termination of pregnancy. This act was put into place because there's a lot of societal discrimination against girls and women. And technology is being used to determine whether a fetus is female or male. Upon finding the fetus to be female, many people have an abortion because they do not want a female child. To counter this discriminatory practice, the PCP-NDT Act was introduced, which made it illegal to tell the sex of the fetus and have an abortion because the fetus was female. While this law limits a woman's right to abortion, it also aims to protect women from discrimination. With this, we complete the final module of our program ARSH4U. In this video, we discuss the various forms of contraception, the different types of abortion procedures, and some acts that cover the legal aspects of abortion. We would now encourage you to review all the activities given in the module and complete your assignments. With this module, the video component of our program also comes to an end. I hope you have enjoyed watching these videos as much as we enjoyed making them. Your comments and feedback on the program would be of immense help to us. Please do write to us at contact@educately.org. I would encourage you all to continue reading on different topics on adolescent health to stay abreast with the latest developments in the field. Our portal, Educately, has curated a number of resources on adolescent health and well-being that may be of interest to you. Please visit us at educately.org and look at the core issues. And remember to counsel your students with empathy, care, and respect. Goodbye.